Hey everybody, it's Tamara Thompson here, and I'm super excited because I have a special guest with me today, and we're going to talk a little bit more in depth on how healthcare professionals and nurses in that industry are utilizing social media and video marketing right now, because it's the way that things are going right now. I believe everybody is online, if they're using it for a good cause or not. They're there and they're watching and they're paying attention to what's going on. And so my guest today is Melissa Batchelor, PhD. She's a nurse and she's got so much background and so much more. So I'm actually going to let her introduce herself on that. So Melissa, thank you so much for joining us today.
Thank you for having me. So I guess the easy answer when people ask me what I do is I just tell them I'm a nurse, because if you go much further than that, you can see people. But I'm a nurse. I'm board certified in geriatric nursing, so I care for older adults, and I've always worked in nursing homes and long-term care. I'm a family nurse practitioner. So when I got my master's degree, it was a clinical degree, and went back to do geriatric primary care at that level. Then got my PhD. And that moved me into being more of a nurse scientist. So I'm a nurse practitioner, nurse educator, nurse scientist, but all around geriatrics. And then recently did a health policy experience, a fellowship. And the social media part is actually also becoming a part of my business. So I've done a lot of national talks about that, and trying to help nurses and new academics learn how to use social media to communicate our science to the public. Mm-hmm. In a nutshell. Maybe that was like 1 minute.
I love it. Well, I think one of the things we were talking about before we hopped on here is the thing I've noticed, you've probably noticed this as well, is the biggest thing I've seen is nurses actually utilizing TikTok and social media to really communicate a message of how important it is to stay home and stay safe during this time. And it's been really disheartening at times. I've seen emotion through nurses that have been crying and just saying like, hey, like they're like, today we lost 4 people, to this virus. And it's really like people are doing memes and people are doing all these things on social media, but it's one of those things that I think needs to be addressed at this time about really how people, I think, should take things more seriously within the media right now. Some people are saying, well, I just need to turn off the news for a while, which I understand, but also need to stay educated on what's going on in the world, because it is our lives. It's everybody else around us too. And nurses being one of the primary people that are surrounded by this virus all the time, I can see the fear in their eyes in some of these social media posts. What are some of your thoughts on like what's going on with that? Like it really is disheartening at times.
Yeah, and I don't really understand why people aren't getting the message or why they don't think that it is a major issue. I know that like before March 11th, I was still trying to catch up and figure out what was going on. I actually had family ask me the weekend before, we were at a volleyball tournament, so it might have been 2 weekends before, and asked me kind of what I thought about COVID. And at that point in time, I was like, well, it's just the flu, nothing to worry about. And then fast forward to like March 11th, and I was like, by that time, like it was coming more into my world. And I was like, okay, maybe I probably should look this up. So I looked at the CDC website, the World Health Organization's website, recorded a podcast, because I was like, if older adults are a high risk group, people need to understand why are they high risk. And so recorded that podcast. Well, by the weekend, I was looking through social media and reading different news articles and rechecking, the CDC and the World Health Organization's websites, and was like, wow, this is a vastly, vastly different bug that we have never seen before. I mean, the last time, it was with the 1918 influenza virus, and you can go online and read about the difference between, what other cities did and what Philadelphia did, and look at these kind of modeling. And I think when I saw the graphics, that's when I was like, okay, this is like super serious. And, but I am still seeing like Wrightsville Beach this weekend. That's where I'm from. People are still on their boats. They're all standing around at Masonboro. And I'm like, what part of this are you not understanding? And I think initially, everyone did kind of think of it as like a snow day or like, school's out for summer. But I don't know. I mean, I've been called a lot by reporters asking why older adults are not staying in and observing kind of the social distancing recommendations. And I'm like, this isn't issue just about older adults. I mean, this is an intergenerational issue and it's an American issue. I think that, this sense of freedom and the fact that our government can't shut us down like China did, like Italy did. In the United States, it takes a lot before the government is going to do. I mean, they've done a lot already, but everybody from New York went down to Florida. Now they're having to, check at the state border. Are you a visitor? So I don't understand why other people don't understand the direness this is creating. And in 2 weeks, like I look ahead and I'm like, we will not be done with this in April. It's going to be May, June, because people aren't listening.
Yeah. Well, and I think that and I know you work more in the sense of like, on the elderly, on that side, that's your experience with geriatrics and things like that. But the thought that I'm seeing posts out there and comments and situations and stories, there is a 50-year-old woman that died in my city this past week. 50-year-old woman, middle age. She's not considered really elderly, right? And then I read another comment within Arizona, a 38-year-old woman that's very close to my age, and then a 19-year-old. I think people just need to understand that this isn't just for, sense of elders and things like that. And it's just really is getting to me a little bit too, because like you said, you saw people that were out hanging out on their boats and not taking it seriously. I had the same situation. I drove down to went out to go up to get some stuff, some materials and stuff like that for me, but I never got out of my car other than to go into the store real quick. And then I came back, but we drove by this lake that's down the road, and it literally, they're all out in their boats. They're doing stuff. They're hiking. There's this one area where they're all out at picnic tables, and I was just kind of disgusted because I was like, they're not even 6 feet away from these complete strangers, and this is how this spreads. And so it was just very intriguing to me on that. But I think it's just the sense that people aren't really listening to the nurses, even in these videos. But this is also a time for nurses and healthcare professionals to step up and be able to share this information more. And I know you're doing that with your podcast as well.
Right. So, I mean, and I actually was telling you earlier about this conversation I had with a colleague of mine at University of Texas, Austin, and she is a public health nurse. And between the two of us, I was like, we should figure out like what message we want to get out. And both of us are, people don't understand the role of a mask and the differences between a mask, and they don't know how to put gloves on and take them off, correctly. And I think this is going to it needs to be like a big public health initiative. We don't have a national infectious disease emergency preparedness plan. Like I'm from, the beach, Wilmington, North Carolina, and they have like annual hurricane preparedness parties. I mean, or like not parties, but I was thinking about hurricane party, but they have, where you get a bag with the information. It says, here's all the things that you need to have on hand so that you're ready for hurricane season. We need to do this for flu season. Mm-hmm. And then, preparing for pandemics needs to become part of the norm. And there's a lot of issues now. I was on a call this morning where we were talking about advanced care planning and advanced directives. And, that is something that we're all told to have in place. Mm-hmm. I don't know how many Americans, do, but this is the time, if you don't have an advanced directive in place, like that, all of those things would become kind of part of this emergency preparedness kit so that somebody could make decisions for you if you end up on a ventilator. But my concern is we're not going to have enough. They're putting up makeshift hospitals in Central Park. The Navy brought in a ship to New York. So if you have your head buried in the sand and you don't think this is a big deal, just look at the amount. I think another ship was out in like San Diego. So like this is a big deal. And the problem is that those aren't even being brought in for the COVID patients, because they're being brought in to take care of the normal things that happen. Are you in the middle of a heart attack? Have you broken a bone? Because we are just we're not going to have the capacity. And for people not to understand it, I think we feel like we're, America, we've got all these resources, everything's going to be fine. But at the end of the day, if you aren't practicing social distancing, there's a chance that you're going to get sick and you're going to need help and you're not going to be able to access it because of the surge of people, So.
And that's one thing I think that people aren't taking seriously either, is the sense like, oh, well, I'll just call my doctor, or I might have some symptoms. And then, it gets to the point where they're really sick and they do want to go to, the hospital, and then there's not enough beds or there's not enough ventilators or whatever that looks like. It's not something that's we're running out of resources. Look at New York. We have a lot of clients actually in New York, and we're listening to their stories daily. And it's very, very serious in New York. Like, it's very scary there, and people are just still doing things. And what would you say? What would be a good recommendation for people? I know that you're doing this right now with podcasting, getting content out there, but what do you think that the industries can do more of right now to continue to bring this awareness through over the next few months? Like, what do you suggest more of the healthcare providers do and the nurses do to continue just sharing that knowledge? I mean, obviously a lot of them are using TikTok and Facebook and things like that. But is there anything that comes to mind that, you think that more of them should do to help support each other to share that information?
So, we have 4 million nurses in the U.S. We're the largest demographic, or the largest segment of our healthcare workforce. Most people know a nurse. And so, using your own personal influence, whether it's like, texting somebody, you're making phone calls. I'm using social media to reach out to my personal network through like my personal Facebook page, and then I have the public facing part of that, but passing on like accurate information, and continuing to reinforce, the messages from the CDC, that social distancing is what you need to do. And it doesn't look like a group of people, out on, some island, and on your boat, unless all those people live in your home. Because you can be within 6 feet of people that you live with already. But, it's just interesting because here, like, I go on walks now, and it's awkward. It feels really awkward to have to walk around somebody, but that's what we're doing. Like yesterday I went for a walk, and there was, a couple with their baby in a stroller, and I hopped off the sidewalk.
Just went around
to pass, Yeah.
And very awkward. Like, you're literally like, you see like 2 people coming, you're like walking, and then you see people like pivot and turn, and they're like, well, I'm going to go down this way. And then you decide to go across the street the other way. So it's just like just a eerie feeling, I think, at times, just seeing that we're going through this. And people are creating these.
With space too. Like, you think about it, and this is actually part of my dementia care training, but your personal space would be if you were standing pretty close to somebody. And then there's a 3-foot distance that you'll stand if you're standing in line behind somebody. But that distance is different than if you're standing at an ATM. Mm-hmm. If you're saying, so basically social distancing is pretending that you're at an ATM, like that's how far away you need to be, but that feels awkward.
When you're saying, like, if you have your arms straight out, if your arms are straight out and it's like this way, to this way, like you both have your arms out, like you should not be able to touch, like
right.
With your arms fully out, like you're got that bear hug going on. But
that might be an interesting TikTok video to do, like the social distancing dance.
You should create it. We'll share it. Yeah. No, we were considering trying to create some stuff for TikTok too during this time, because it's the nurses are really like crushing it on there, but they're very emotional. It's not like, some of them could be a little bit fun because some people need some humor during this time. I totally understand that, but they also need to understand that these women and men are coming in there, and nurses, and saying like, hey, like I literally saw these women crying. They're like afraid to go to work in the morning, but they're there to help serve people. But it's getting bad in specific areas, and it's going to keep going if they don't. People just don't take it seriously at this point. So
yeah, well, if we're calling 9,000 healthcare professionals, from retirement to come back into the workforce, and we're putting Navy ships, off the coast to help handle the burden on the hospital and healthcare systems, I think people just need to educate themselves. As somebody posted something yesterday where they had actually gone to the CDC website, which is what I had recommended that people do. And they're like, oh my God, I learned like so much. So you have to be kind of a self-directed learner to educate yourself about what you must not be understanding. But I think it's going to take more, and a lot of times it's not just the individual making decisions. I see, now we have cities and communities, like restaurants are closed, only opened, for takeout. We've ordered pizza. So it's been interesting to watch how different businesses are handling thing. So like if you order a pizza here, they'll bring you the pizza, but they'll put it like on your porch and they ring the doorbell and like kind of run off. And I'm like, okay. But they tell you that like when you're ordering, but you know, we can live on cardboard for, you know, what, 19 hours or something. I mean, so even with that, at least they had it wrapped in a plastic bag, but then you still have to take it off, wash your hands. So it's that type of infection control education. I think that people need, understanding the differences in these masks and why that N95 was such a big deal. And we did get legislation passed, you know, to make sure that nurses have those things. But again, if you don't have the supplies, you know, then you're putting yourself at greater risk with the super, super nasty bug.
Yeah. Do you think that, I think that this is a great opportunity for more people like yourself and other leaders in the industry and the healthcare field to use more PR too, reaching out to more of the news stations. And I know you've been reaching out and getting some things with articles and things like that, publications.
We are last weekend. And so, but yeah, I've been contacted by several different news outlets.
That's awesome. It's just one other medium for people to utilize in this time, and because the news stations are still, you know, looking for different ways, creative stories, people that have good lighting within their own space that can do a Skype video.
I noticed that. I was like, you know, even the news reporter, the journalists are reporting from home, and I'm like, you know, you have to think through those things. So
yeah. And as people are noticing that, I mean, I hope people are noticing that the news reporters are even doing stuff within their own homes too, because, you know, you don't want to spread those throughout stations. So they've closed down so many different things. And I hope they continue to shut down more things. There's still things here that I'm noticing that are open, even small businesses that are maybe suggested to close that are trying to stay open anyways for the sense of being a small business owner. And I understand the pain, but it's great that there's different types of relief that's being suggested and offered for SBA loans and things for people that may want to go that route or not. But it's just thinking about how we can get that message out there a little bit more during this time, instead of having people think that they have to keep their business open, allow the essential workers to, you know, go into work and take care of people the way they need to, and everybody else stay home and stay safe. It just really, really shocked me when I went down to the store and there's just all these people out on these boats and riding bikes and stuff. I'm just like, my goodness gracious. And then the sense of, I think what did you see the parade of teachers? And then they started doing that. It went viral. So the other people started doing other states where they had lines of 100 cars with the teachers going through the neighborhoods, honking, waving, kids hanging out the windows. I have a video of it passing my neighborhood. And one of them started on TikTok, and then they did it here in my neighborhood. And it's just a line of cars, people honking, saying, "We miss you, students." But I thought that was a little bit interesting on the sense of the teachers putting out a different message of staying safe as well. But I mean, everybody has their opinions, but I felt like that was just, people shouldn't be trying to follow the mold just to have some type of viral video on TikTok, you know?
So I really think, because I was watching a movie this past weekend with my 13-year-old, and 1917 is the movie, and it's about World War.
The war movie. Yes.
Yeah, and I thought, you know, I'm sitting there on the
beautifully filmed too. If you watch the entire first half of the film, if you noticed, it was entirely one take. The first 30 something minutes is just one take. The video and movie is following that. So you have to understand that has to take a big deal to keep that scene going through all those parts of where they were moving. That was a very, very well made movie. Obviously, as a filmmaker, I understand and appreciate that movie.
So, but in that movie, it's World War I, and the soldiers are going in, and it's a very active process. You know, I'm the soldier, there's our enemy, you know, we have bombs, and everything is action-packed. This particular war is a war of inaction. And I think that's the part the public doesn't understand. You will win this war by sitting on your couch watching Netflix. You're not going to win it, you know. So when people get stressed, they feel like they want to go do something about it, and they want to take control of it. And in this situation, the way to take control of it is to not to not go out. So I think that's the hard part that people are struggling with. This is a war, but it's not a war like 1917.
Yeah. Well, people need to think about, like, this is like a war within our own country, but also within multiple countries at this point. And you can imagine what other people are seeing now that our country is being taken over massively more than a lot of the other countries. They're probably thinking like, wow, look at what's happening to the US right now. It's because we're not taking action to stay home, and where these people are getting the fear struck out of them by watching us. And I'm sure these countries are just buckling down and taking the action to actually stay home, and so it's just, people need to lead by example. But here they're starting to see the red dots multiply over and over and over. I watched last week, and there was an additional 5,000 cases updated in New York within a day. People need to realize this. But I am glad that the nurses are saying stuff, though, and the healthcare providers are posting more on social media and trying to get people's attention to really educate them that this is serious. And if you have to go to the store for one thing, you probably shouldn't try to just get it off Amazon if you can. Right. I had went in the very beginning of this and kind of stocked up on a bunch of different necessities for foods and items and toiletries and things like that. And I went in there and I came out, with a full shopping cart to prepare with in the beginning. And there were people in there just getting one item with their family of four, just kind of hanging out. And I'm assuming that some of them are still doing that. If there's not a reason to go to the store for real, like you really need something, like don't do it. Like don't go there. There's no point of doing it. So, but yeah.
Yeah, make a list, and I think I might be good now to not have to go back for a couple of weeks.
I'm good for like a month, but that's just me. But see, the thing is I'm grateful that I've actually am an entrepreneur and can work from home, and that I've really set myself up to be able to prepare for something like this before I'm used to working at home. But not many are not used to that. So this is very hard for people, and I can understand them going stir crazy with all their family members and things like that, and pets and kids. And now the fact that today they just announced here in Arizona that our district is being closed indefinitely for the school for semester, that nobody's going back. So the seniors are missing they're missing their graduations, they're missing their proms, they're missing all these things that they look at.
I have two seniors. I have a senior in college and a senior in high school. And so all of that is taken off the table. So it's not just their loss, it's the parents' loss.
Yeah. It's hard because you can see it in different ways. But if there's anything else that you want to add to this topic before we close out today, is there anything else that you can think of that would help people just to pay attention more to what's going on in the media, on the respect of not like, oh, I just don't want to watch the news anymore, but to stay educated, like really find areas where they could become educated in that sense. And I really do hope that more healthcare providers continue to put themselves out there in the media and podcasts and videos just to share that message more, because it's really those people that they're looking to right now for leadership as well as education. And those people are going to be known for a while going through this too. So,
yeah, I would say just, making sure that you're looking at the CDC website, be sure that you understand. I mean, I loved Ellen's, Corona log, which is what she called it. And it was like the whole hand washing thing. Mm-hmm. And she highlighted the 7 steps that the World Health Organization was recommending. But, when you should wear a mask, when it's not even appropriate, and basically, just social distancing. We just need to stay. This is a war of inaction. We're being asked to be soldiers by being inactive. That doesn't mean that you can't go outside and get your exercise and to walk, but you do need to stay home. And if you do have to go out, practice the social distancing and be sure that you're washing your hands and taking, wet wipes with you, because this is a nasty bug and we're only at the very beginning of it. In the next 2 to 3 weeks, it's going to be like you're going to watch images on the news, and I can only watch the news like once a day. Otherwise, I just spend my whole day thinking about this. So I just take 1 hour at the end of the day, catch up, and then, turn on Netflix or whatever it is I need to do. So if there are resources too. Like if people are having struggles with, mental health or with, cabin fever, there are hotlines that you can reach out for, and, to try to support the small businesses as much as we can with takeout deliveries or gift certificates, and, but not going to actively have services done right now. It's just not smart.
Yeah, no, I fully agree. So, well, I appreciate you just being here today and just sharing a little bit more information. And those of you that are listening and want to learn more information and stay updated, I definitely recommend subscribing to Melissa's podcast. This is Getting Old by Melissa B, PhD. And you can look up her website as well. And we'll also put that in the notes. Melissa, is there any other social media platforms that you're posting video content or updates right now that they could also be aware of?
Yeah, so Facebook is Melissa B, PhD, LinkedIn, Melissa Bachelor, and then Instagram, Melissa B, PhD _ the nurse. And then the YouTube channel is Melissa B, PhD, and the podcasts are posted there. And then my website is melissabphd.com. So at least it's all mostly consistent. Instagram's my outlier.
Awesome. And we'll provide that information in the description for the show as well. Well, I appreciate you so much for being here, and thank you everyone that's joined us and those that will watch the replay. So thank you. Stay safe, stay home, and take care. Until next time. Bye.
Bye. Thank you.
And thanks for watching this video. I really appreciate you guys taking time to check this out. For those of you that feel inspired, want to subscribe and ring the bell, go ahead and do so, and definitely check out more videos just like this one over here. Tap the screen, and I'll see you next time.